Hello, everybody. The topic today of discussion is nutritional management of eating disorder. Here we will discuss what is eating disorder, types of disorders of eating, their definitions, and how do you manage them. Also, if you will not be able to manage them, what will be their consequences and what are their results. Okay, so now we will start with the definition. What is eating disorder? Eating disorders are illness in which the people experience severe disturbances in their eating behaviors and related thoughts and emotions. People with eating disorders typically become preoccupied with food and their body weight. In many cases, eating disorders occur together with other psychiatric disorders like anxiety, panic, obsessive compulsive disorders, and alcohol and drug abuse problems. New evidence suggests that heredity may play a part in why certain people develop eating disorders, but these disorders also afflict many people who have no prior family history. Okay? So that was the definition. Now we go into some types of eating disorders and also their definitions. The most common of them, as we know as, is anorexia. It refers to the loss of appetite. We see many patients admitted in hospital with this cause. Okay, they are not age biased. That means they can happen to anybody. It can also happen in children, and it can also happen for an old people. So anorexia, it refers to loss of appetite, especially as a result of diseases. Anorexia nervosa, a disease characterized by refusal to maintain a minimally normal body weight, with the intense fear of gaining weight or body image distortion. Binge, an episode of eating marked by three particular features. 1. The amount of food eaten is larger than most persons would eat under similar circumstances. 2. The excessive eating occurs in a discrete period, usually less than 2 hours. And 3. The eating is accompanied by a subjective sense of loss of control. Then we have binge eating disorder, a disorder characterized by the occurrence of binge eating episodes at least twice a week for a 6-month period. So now it means let me tell you, anorexia nervosa, it is the refusal of eating by a person because he or she is fearing that he or she might gain body weight. Okay, so he or she is so immersed by the concept of maintaining a good body image that he or she does not want to increase his or her weight by eating any sort of food. Now second type we have, it is known as binge, which means that you eat certain amount of food after 2 hours interval, and it is also accompanied by a loss of control of hunger. You cannot stop eating. You keep on eating and eating and eating. Okay. Now we come to definitions of some common eating disorders. Bulimia nervosa, a disorder characterized by repeated episodes of binge eating following by inappropriate compensatory method such as purging, including self-induced vomiting or misuse of laxatives, diuretics, or non-purging, including fasting or engaging in excessive exercise. Means this person who is suffering from bulimia nervosa will have binge eating initially, and then he or she will try to compensate the eating by induced vomiting. মানে বমি করে বা খেয়ে উঠে পরে মানে এক্সেসিভ এক্সারসাইজ করবে, তারপরে ফাস্টিং করবে, কিন্তু আবার ওইগুলো একটুখানি ঠিক হয়ে গেলে আবার পরের দিন কী করবে, আবার অনেক বেশি করে খাবে, আবার ইনডিউস বমি করবে, আবার এক্সারসাইজ করবে, আবার ফাস্টিং করবে, এরকম দিস ইজ মানে একটু চেনের মতন যায় আর কি। তারপরে হচ্ছে ইটিং ডিসঅর্ডার নট আদারওয়াইজ স্পেসিফাইড, আ ডায়াগনস্টিক ক্রাইটেরিয়া ফর ইটিং ডিসঅর্ডার দ্যাট fail to meet full criteria, anorexia nervosa or bulimia nervosa. Okay, and purging, it is a method intending to reverse the effect of binge eating. This may involve self-induced vomiting, which is the most common purging method. Okay, as I already discussed, the bulimia nervosa এটা মেনলি হয় আর কি। Additional methods may include laxative, enema and diuretic abuse. Basically abuse of all the drugs that is easily available over the counter in order to remove the amount of free food that the person has had during the binge eating. Okay, now next we go on to anorexia nervosa, and we will discuss it in details. Okay, complex eating disorder characterized by obsessive pursuit of thinness through dieting with extreme weight loss and disturbance of body image. Okay, they are characterized by voluntary restriction of food, distorted body image, fear of gaining weight. কিছুটা সাইকোলজিক্যালিও হয়, যার জন্য এই কন্ডিশনটা ওই পেশেন্টের উপরে ইনডিউসড হয় আর কি। ডায়াগনস্টিক ক্রাইটেরিয়া ফর অ্যানোরেক্সিয়া নার্ভোসা: ওয়েট লস of at least 15% of total body weight or body mass index, which is lesser than 17.5, avoidance of high calorie foods, distortion of body image so that patients regard themselves as fat even when grossly underweight. Not accepting that he or she is underweight, they tend to think that they are fat. Amenorrhea for at least 3 months. In post-menarchal females, amenorrhea, that is absence of at least 3 consecutive menstrual cycle. Okay, medical complications of anorexia nervosa: the patients deny hunger, they deny thinness or fatigue despite profound weight loss. They may be preoccupied with food and may take pleasure in cooking and serving meal for others. Okay, they take it as a habit. They'll cook the food, but they themselves will not eat the food. They generally have constipation and are intolerant to cold. Patients are hypothermic and often wear more clothing than is environmentally appropriate. Hypothermic means they respond to the body temperature is very low actually. That is what it means. In severe cases, the bones protrude through the skin as there is hardly any body fat. Okay, so you may probably having an idea in your mind that how a patient suffering from anorexia nervosa may look like. Okay, medical complications of anorexia nervosa: again, the skin may be dry and scaly, palms may be yellow because of keratonemia, high level of yellow pigment keratin in body hair is increased, frank hirsutism, that is excessive growth of coarse hair in women, edema may be present, and parotid glands may be enlarged. Okay, ওটা ছিল তোমার anorexia nervosa. Now we will discuss what is bulimia nervosa. Eating disorder refers to binge eating followed by purging, resulting in an average of or overweight body due to the residual amount of calorie. Okay, they are characterized by low self-esteem, over-concern about shape and weight, extreme dieting, binge eating, compensatory purging, that is self-induced vomiting, or the use of laxative or diuretics. যা পাবে খাবে, ঠিক আছে, বিকজ ওরা কন্ট্রোল করতে পারবে না। তারপরে খাওয়ার পর কি করবে, সাথে সাথে গিয়ে গলায় আঙুল দিয়ে বা এনি হাও বমি ইনডিউস করবে আর বমি করবে। যদি এটা না হয় তারপরে কি করবে, ওরা ল্যাক্সেটিভ খাবে। ল্যাক্সেটিভ দিজ আর মেডিসিনস উইচ হেল্পস ইউ টু ডেফিকেট আর কি, মানে তাড়াতাড়ি পটি হবে, ঠিক আছে, এগুলো। অ্যান্ড ডায়রেটিক্স মানে যে লিকুইড মানে শরীর থেকে বার করে দেয়, এইগুলো হচ্ছে ওষুধগুলো আর কি। Diagnostic criteria for bulimia nervosa. When can you diagnose a person with bulimia nervosa? They have to have this characteristics before you diagnose them with a bulimia nervosa characteristic. Okay, so recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following: eating in a discrete period of time, example, within any 2-hour period, an amount of food that is definitely larger than most people would eat during similar period of time under similar circumstances. And number 2, a sense of lack of control over eating during an episode, example, a feeling that one cannot stop eating or control what or how much one is eating. Okay, so it's simple and self-explanatory itself, so I don't think so I need to explain it to you. So this is the main characteristic. Second, self-evaluation is unduly influenced by body shape and weight. Recurrent inappropriate compensatory behavior to prevent weight gain, such as self-induced vomiting, misuse of laxative, diuretics or other medication, fasting or excessive exercise. Okay, এটা আগেও ডিসকাস করেছি আমরা। Binge eating and inappropriate compensatory behavior both occurs on an average of at least twice a week for 3 months. Okay, so this is a very disturbing thing which a person মানে suffering from bulimia nervosa exhibit. Okay, so it is basically doing some stuff which is inhumanly to one own self. Medical complication of bulimia nervosa: purging, menstrual irregularities, swollen glands, frequent fluctuation in weight, inability to voluntarily stop eating, feeling guilty and ashamed about eating. Okay, depressive moods, overreacting in reaction to emotional stress. So these are the complications. Also they have cardiac arrhythmias, renal impairment from hypokalemia, muscular paralysis, urinary infection, epileptic seizure, tetany from hypokalemia, alkalosis, swollen salivary glands, eroded dental enamel, and injury to mesenteric plexus of large bowel. Okay, binge eating now ওটা ছিল তোমার বুলিমিয়া নার্ভোসা। নাও আমরা ডিসকাস করব যেটা হচ্ছে বিঞ্জ ইটিং ডিসঅর্ডার, যেটাকে ডিসঅর্ডার বলা হয়। ঠিক আছে, কেন এটাকে ডিসঅর্ডার বলা হয়? উই উইল রিড থ্রু ইট। Binge eating disorder is a psychiatric disorder in which a subject, number 1, periodically does not control overconsumption of food. Number 2, eats an unusually large amount of food at one time. Number 3, eats much more quickly during binge episodes than during normal eating episodes. 4, eats until physically uncomfortable. 5, eats large amount of food when they are not really hungry. Number 6, always eats alone during binge eating episode in order to avoid discovery of the disorder. Okay. Number 7, often eats alone during of normal eating owing to feelings of embarrassment about food. And number 8, feels disgusted, depressed or guilty after being binge eating. So এটা ছিল তোমার binge eating disorder, যেটা আমরা ডিসক্রাইব করেছি in terms of your point wise. Okay, so how is it different from your bulimia nervosa? It is different because they are eating disorders based on a psychiatric disorder of a person. Okay, because they do it periodically, মানে একবার খাচ্ছে একবার খাচ্ছে না, মানে একবার বিঞ্জ ইটিং করছে একবার বিঞ্জ ইটিং করছে না। কিন্তু বুলিমিয়া নার্ভাসাতে যখন ওই মানুষটা খায় তখন কিন্তু সে বিঞ্জ ইটিংই করে আর কি বেসিক্যালি। ঠিক আছে, নাও নেক্সট উই মুভ অন টু ইটিং ডিসঅর্ডার নট আদারওয়াইজ স্পেসিফাইড, EDNOS. A diagnostic category for eating disorder that fail to meet full criteria for anorexia nervosa or bulimia nervosa is termed as eating disorder not otherwise specified. Okay, যেটা কোনো ক্রাইটেরিয়া যেটা ফুলফিল করতে পারছে না সেটাকে আমরা একটাতে ইয়েতে ঢুকিয়ে দিচ্ছি, যেটাকে আমরা লেবেল করছি eating disorder non otherwise specified. Patients who fall under eating disorders not otherwise specified constitute about 50% of the population suffering with eating disorder. মানে অনেকটাই বেশি আর কি. If the patient left untreated may develop full-fledged anorexia nervosa or bulimia nervosa. Over the period of time they will be diagnosed with anorexia nervosa or with anorexia or bulimia nervosa. Okay. তো নেক্সট হচ্ছে আমরা diagnostic criteria for eating disorder not otherwise specified. For females, all of the criteria for anorexia nervosa are met except that the individual has regular menses. All these criteria for anorexia nervosa are met except that despite significant weight loss, individual's current weight is in the normal range. All the criteria for bulimia nervosa are met except that the binge eating and the inappropriate compensatory mechanism occurs at a frequency of less than twice a week or for the duration of less than 3 months. মানে কোনোটার কোনো ক্যারেক্টারিস্টিকের কোনোটা প্রফর্ম জিনিসটা নেই, ও এইটাও এক্সিবিট করছে ও ওটারও এক্সিবিট করছে। The regular use of inappropriate compensatory behavior by an individual of normal body weight after eating small amount of food, repeatedly chewing and spitting out but not swallowing large amount of food, binge eating disorder, recurrent episodes of binge eating in the absence of the regular use of inappropriate compensatory behaviors characteristics of bulimia. সো এখন অবধি আমরা ডিসকাস করলাম যে আমাদের কী কী ইটিং ডিসঅর্ডার্স আছে, তার ক্যারেক্টারিস্টিক্স কী আছে, তার কী কারণে হতে পারে বা তার কী কারণে হতে পারে, তার কী কারণে হতে পারে, প্লাস মানে কী হয় আর কি। নাও উই উইল মুভ অন টু ট্রিটমেন্ট অফ ইয়োর ইটিং ডিসঅর্ডার। ওকে, দ্য ট্রিটমেন্ট অফ ইটিং ডিসঅর্ডার ক্যান বি সেড টু হ্যাভ 3 কম্পোনেন্টস। ফার্স্ট হচ্ছে psychological management, second হচ্ছে medical and biochemical management, and third হচ্ছে nutritional management. Okay, now moving forward to what does the psychological management comprise of. Establish good and caring relationship with the patient, cognitive behavior psychotherapies. Family therapy is more effective than individual psychotherapy in adolescence. Supportive care therapy. Medical and biochemical management involves antidepressant drug therapy, deep brain stimulation or DBS for chronic and treatment refractory anorexia nervosa. DBS was associated with improvements in mood, anxiety, affective regulation, and anorexia nervosa related obsession and compulsions. Okay, now we come to nutritional management. Nutritional management consists of restriction of variety of acceptable foods, restriction of use of alcohol, establish normal pattern of food intake, maintain body weight within a normal weight, encourage a nutritional intake appropriate to the individual's need, use of vitamin, mineral supplements. Okay, include exercise schedule, establish present condition that may affect nutritional requirements such as infection or any trauma, growth, calculate rate of weight loss or weight gain. Nutritional management considered now the nutritional management is considered in terms of 3 consecutive phases. Now what are the phases? They are resuscitation, repair and repletion. Okay, now we will explain it in brief. Resuscitation. First, identify and correct medical emergencies such as hypothermia, hypoglycemia, electrolyte disturbance, dehydration, and cardiovascular function as far as possible. Infections may also be treated. Okay. Next হচ্ছে repair. Repairing of the tissue organ functions cannot be restored until the cellular activity has been repaired. In this context, the correction of multiple specific nutrient deficiencies needs to be corrected. Repletion. The ultimate objective of treatment is to return body composition to normal, but abnormal body composition can only be corrected safely when the cellular machinery has been adequately repaired. Any aggressive attempts to drive weight gain at an early stage of treatment or correction of abnormal blood chemistry are potentially dangerous. Hence, slow and systematic repletion of treatment regime needs to be considered. তার মানে হচ্ছে রিসাসিটেশনে হচ্ছে আগে মেডিকেল ইমার্জেন্সিসগুলোকে ট্রিট করা হয়। যদি কোনো পেশেন্টে হাইপোথার্মিয়া, হাইপোগ্লাইসেমিয়া, ইলেকট্রোলাইট ডিসব্যালেন্স, ডিহাইড্রেশন এগুলো হয়ে থাকে, তাহলে সেই জিনিসগুলোকে আগে আমরা ট্রিট করব। ওকে, তারপরে আসছে আমার রিপেয়ার, যেখানে হচ্ছে সেলুলার অ্যাক্টিভিটিস যেগুলো আছে উইদিন দ্য ইন্টারনাল অর্গ্যানস সেগুলোকে আমার রিভাইভ করতে হবে। By how do you revive those? By the correction of specific nutrient deficiencies. যেখানে যেখানে ডেফিসিয়েন্সি হয়েছিল সেখানে সেখানে আমরা সেটা দিয়ে সেটাকে মেকআপ করার চেষ্টা করব। দেন হচ্ছে রিপ্লেশন। After your cellular activity has been repaired, then you can achieve the repletion of the whole organ system, and finally you can add a small amount of diet to the patient, which will help in their weight gain, but slow and steadily. Okay, aggressive treatment korle kintu cholbe na. Calorie intake. In case of anorexia nervosa, initial intake, most severely ill patient intake level should start from 1000 calorie to 1600 kilocalorie per day. Weight gain phase. Intake may have to be increased to as high as 2200 to 2500 kilocalorie per day. This calorie intake will lower when weight increases. Carbohydrate intake should be 65 to 70% of the total body weight. Protein intake should be gram per kg ideal body weight. Fats, a dietary fat intake range of 25 to 30% of calorie is recommended. Micronutrient use of prophylactic thiamine supplement in oral form is recommended for inpatients and those undergoing rapid weight gain. It is recommended to give 25 mg per day. Okay, vitamin D requirements are higher than average. Vitamin D supplements are also recommended. Now, calorie intake in case of bulimia nervosa. Initial intake again from 1000 to 1600 kilocalorie. We may decrease as low as 1200, then we can gradually increase up to 1400 kilocalorie. Okay, this is during the weight loss phase. We include carbohydrate, should be total of body 50 to 60% of total energy. Protein intake should be 1 gram per kg per ideal body weight. Fats, a dietary fat intake range of 25 to 30% of calories is recommended. Some amount of dietary fat may be encouraged at each meal. Further, it would be beneficial to include some sources of essential fatty acid in the diet. But here you can obviously increase the amount of protein. You can give amount of protein like 1.2 to 1.5 gram per kg ideal body weight, so as to compensate the amount of carbohydrate that we have been given, because we have given less amount of carbohydrate. Okay. Now, nutritional management. Next আসছে তোমার nutritional counseling and education. Okay, as I have already discussed earlier that counseling is very important. Okay, your main goal or that you want can be achieved only by the means of proper nutritional counseling. So let me read through it. And important components of management of eating disorder. Nutritional counseling can be used to accomplish a variety of goals, such as reducing behaviors related to the eating disorder, minimizing food restrictions, correcting nutritional deficiencies, increasing the variety of food eaten, and encouraging healthy and not excessive exercise pattern. Nutritional education is an important aspect of the treatment. The patients report an extremely good knowledge of food and nutrition. Next prognosis. About 50% of the patients recover fully from anorexia nervosa and achieve normal weight. 30% improve but have a partial recovery, and 20% will have lifelong problem with eating patterns. Older age of onset, long duration of illness, extreme weight loss and significant depression result in poor prognosis. Bulimia has even poor prognosis because of medical dangers and severe psychiatric disturbances. The suicide rate is also high in bulimia patients. Almost 40% of treated patients remain bulimic after 1.5 years of treatment. About 2 by 3 experience relapse within a year of recovery. The outcome criteria, example weight, food intake, proper body image, menstruation, and social, psychological, and sexual adjustments might be accessed for a number of years after recovery. Early intervention and better treatment strategies have helped in reducing the mortality from eating disorders. Okay, so basically it is if you're not able to treat it for a lifetime, you are still going to treat it for a period of time. Okay, so it is not a total loss. So what you can do is, you can always, whatever the intervention or whatever the methods that we have been practicing, you need to keep continuing practicing those methods. You need to keep the patient under proper counseling, under proper checking, okay, so that they do not return to their initial habits. This social, emotional and bond should be there between the patient and the dietitian, and also with his or her families. He or she should be having a very proper bond with the family, so that they do not fall victim to those eating disorders again. Because if they are left alone, or if they are not, if there is nobody to be empathic with them, then they will be falling prey to the same disorders all over again. So basically these are the treatment how we do is like following all those nutritional treatments. Okay, the counseling, the nutritional management, the psychological management, the fight with depression and all. After we have to do this to them periodically. Okay, it should be a routine for them. It should not go and stop out there. So with this we come to the conclusion of the topic. Thank you very much. Have a good day.